We are just delighted to have as our next speaker, Karen Houseman. And Karen is an experienced Health and Human Services Program Manager and Business Analyst working in government with a focus on program management, leadership, and organizational change management. Skilled in relationship building across organizations, community partners, and with the large organization's various programs, including Medicaid, developmental disabilities, economic assistance, SNAP, Waiver, EVV, and PERM. Those are a lot of acronyms, right? So we appreciate, Karen, your willingness to be part of this training. And please, let's go ahead and welcome Karen.
I'm a little congested today, so I have my iced tea. I have worked at DHHS since 2011. And before that, I worked at the University of Nebraska. So thank you for that kind introduction. First, I'm going to start off by sharing that right before the pandemic, so it was like March of 2020, we did some slight reorganization within the Department of Health and Human Services, and all of the home and community-based waivers moved into the Division of Developmental Disabilities. We're still waiting on a name change, so it doesn't seem logical that for aging services you'd go to the Division of Developmental Disabilities. But we've made some great strides since 2020 on aligning resources, figuring out what's different, what can be the same. We still have a long ways to go as well. In the Division of Developmental Disabilities, we serve as many people as possible while ensuring the health and safety of them while they're receiving services in the community. And we oversee the Medicaid home and community-based waivers. This includes determining eligibility, creating person-centered plans for how they're going to receive their care. Mm-hmm. We pay the providers, so outside of the managed care organizations, it's called fee-for-service, so that's how we pay providers. And we also monitor the services being provided, going back to that safety. Earlier this year, we had the special health care needs population services that used to be in Child and Family Services join our division, along with the State Unit on Aging, which is very exciting. On our public website, you can find more information about the home and community-based waivers, and there's a specific page for participants and families if they want to find information, so lots of great resources on this webpage. So my agenda today is to just go over general waiver information. I'm going to focus on the aged and disabled waiver since this is an aging training. I'll talk about how folks can apply for services and how to start services. And I can answer questions as they come up as well. And I have a strong Medicaid background because I did that before I moved to home and community-based services. So the purpose of our home and community-based waivers is to help people live in the community in lieu of an institutional setting. So the services are paid to wrap around natural support, so maybe there's family, friends, other community supports they're using, so we'll fill in the gaps to help meet the participants' needs. And we want folks to be as independent as possible. We don't want, you've probably heard institution is a state of mind, so we try to help with that independence and knowing about their community options and how to get involved if they choose to. Some service examples, and these kind of apply to various waivers, is to help with household tasks. So the aged and disabled waiver, we typically have providers go in the home and do things for individuals so that they can live there safely. This could include self-care with activities of daily living, so maybe helping them get dressed or bathing or other things involving their person. We also have some services that teach skills to get or maintain a competitive job. We usually ask participants to start with vocational rehab through the Department of Education to get started, but our traumatic brain injury waiver and our developmental disability waivers do have some supported employment services available. And we do have one service on the aged and disabled waiver that I'm working on getting more utilization of, called independent skills building, where if someone wants to learn how to do it themselves instead of having someone help them to help them overcome their disability and live independently, we can work with providers to have that training opportunity on the aged and disabled waiver. Respite is provided to allow the usual caregiver to get a break if that person needs ongoing supervision. We have home and vehicle modifications available, along with assistive technology and emergency response systems. Now with assistive technology, we have to look at what the Medicaid state plan covers first, because the waivers are more of the above and beyond the state plan and the enhanced services available. Home and community-based waivers allow the state to waive certain Medicaid requirements to provide services in the community to avoid institutionalization. So I don't have the exact year in front of me, but in the mid-'80s, there was a child who was in a hospital. Her name was Katie Beckett, and her parents were like, why can't she receive care in the home? And the rules at that time indicated she was only eligible for Medicaid in an institutional setting. So the family advocated and got the attention of President Ronald Reagan, and they ultimately passed legislation that created home and community-based services. There's a Katie Beckett category for Medicaid that allows children to receive services in the home instead of the community under Medicaid. But if they want above and beyond services, we recommend they apply for waivers.
Keep going.
Okay, I feel like I'm not talking loud enough because I'm congested. Medicaid waivers pay for the providers of services and also the service coordination where we oversee the services. And each participant's funding is very individualized. So on the DD waivers, they have tiers and categories for payments. On the aged and disabled waiver, we look at what are your needs? How many hours of care do you need? What services do you need? And we kind of build the budget that way for that. We cannot pay for room and board or rent. We don't pay for general home repair. If there are services for children being used, we don't pay for the routine cost of childcare, but if there's a need for additional care in that childcare setting due to their disability, we pay for that above and beyond care. And we can't give money directly to participants. It has to go through another way. And there are people out there who qualify for multiple waivers, and we're in the process of eliminating the developmental disability waitlist, which will create more opportunity to place them in the waiver that's most appropriate for them. But we don't have a wait list on the aged and disabled waiver, so we're able to help people as they come in. There are 5 home and community-based waivers in the Division of Developmental Disability, the aged and disabled waiver that I'll focus on today. The traumatic brain injury waiver was recently expanded in October of 2023. Historically, we had an agreement with QLI, and they were providing services in a assisted living setting. We now have opened it up statewide. Any assisted living statewide can apply. There's a specialized training for providers to take to learn, so the caregivers are trained on how to work with someone with a traumatic brain injury. And we also have services available for them to receive providers in their own home or apartment or family's home. The family support waiver was just went live in March of this year, and we're in the process of enrolling participants and providers to give them services. The developmental adult day waiver has typically been offered to individuals when they graduate from the school system, and it provides opportunities for competitive integrative employment, day services, and there are some supports in the home to help the individual. The comprehensive developmental disability waiver offers all the things that the adult day waiver offers, but in addition has residential supports, so if they need to live in a group home or a supported family living home. So to be eligible for a waiver, a person has to be a citizen or legal resident of the United States and of Nebraska. They have to qualify for Nebraska Medicaid, and sometimes applying for Medicaid and the waiver go hand in hand. For children, there's an income disregard category legislation called TANF, TANF. I apologize, I cannot remember what that acronym stands for right now, but it allows the parental income to be disregarded and only income that the child has be counted for Medicaid while they're on a waiver, or Katie Beckett. The individual has to meet level of care requirements to be on a waiver. So for the aged and disabled waiver and traumatic brain injury waiver, that's nursing facility level of care, which is assessed by our eligibility and enrollment unit. And for the developmental disabilities, that's intermediate care facility level of care, such as like the Beatrice State Developmental Center. And of course, they have to have a need for waiver services in order to be eligible for a waiver. The language in yellow, that is very hard to read, says Medicaid is a public health insurance program which provides health care programs. No, I'm not going to read that because she just had a presentation on Medicaid. In general, Medicaid eligibility covers a variety of categories, and eligibility is based on income, assets, and residential consideration. I want to expand a little bit on the spousal impoverishment category that Jacob talked about, because this can be used for waivers as well, and that category allows for more than that $4,000 or $6,000 resource, because the individual that doesn't need the waiver services, sometimes I like to lovingly call them the spouse in the house instead of the spouse in the institution. If they have the assets assigned to them, then it wouldn't necessarily count in the Medicaid budget. I'm getting a cue from the crowd that I should talk louder. And then, of course, we talked about the Medicaid expansion program in the previous presentation. So in order to qualify for a waiver, of course, the individual has to be aged over the age of 65 or meet disability criteria through the Social Security Administration. We do have a state review team, which that's actually moving to the Division of Developmental Disabilities as well in a couple weeks, where they gather medical information or review what was submitted and compare it to that Social Security criteria. This can occur while they're either waiting for a Social Security determination or if they were denied for lack of severity. If they were denied for lack of duration, which means you haven't been disabled long enough or you're not going to be, then we say, I'm sorry, you were denied disability. The DM5 form is a form that the doctor fills out that kind of talks about the nature of the disability, and we supplement that with other medical documentation as well. The formatting on the slides is a little wonky, so I'm trying to read what this is. If a person doesn't meet the disability requirement, then we don't proceed with waiver eligibility. That's pretty much what that last sentence says. So now I'm going to focus on nursing facility level of care, which is what we typically look at for adults over the age of 65 or older. And this criteria is used for the 80 waiver and the TBI waiver. I feel like my slide deck got shuffled, but I think it happened before I got it to you because they're not in a logical order to me, but it's my printout too. So I'm going to wing it. I've given this presentation several times, so thank you for your patience with me. Here's a list of the services that are available on the aged and disabled waiver and the traumatic brain injury waiver. As you can see, they're very similar. Assisted living for the traumatic brain injury waiver, CMS thought that sounded too institutional, so we've changed it to supported residential living, but it can only be provided by assisted living facilities. So as we progress and our aged and disabled waiver is renewed, you may start to see supported residential living, which means assisted living. So I don't want to spend too much time focusing on these services, but there are quick guides out there that talk about them in more detail. The services that are used the most in the person's home is personal care, which includes that help with activities of daily living, such as bathing, eating, dressing, cleaning themselves, and it can include components of keeping the household clean. If they don't need that hands-on help from a provider because they're getting it from a loved one, then we could look at authorizing companion or chore to help around the home with maybe cooking meals or keeping things clean. I am going to focus a little bit on services for children. So for children, the extra care for children with disabilities, that's that above and beyond childcare that I talked about. Where above that routine cost of childcare, we could help supplement the care. Home and vehicle modifications are sometimes used by families with children. Of course, we take into consideration the developmental milestones of the children. We wouldn't future-proof a bathroom. You know, like let's say there's a 2-year-old who needs help, we wouldn't modify the bathroom for the future. So many things could change. Respite is often used by families with children, and then that independent skills building service that I talked about, us going in and helping to train, I do have a couple examples where we're using that with children as well. For the TBI waiver, you can see those additional supported employment services, and there's also community connections is to help them get out into the community to do the activities they want to do, but it doesn't include help with activities of daily living. And the other one I want to highlight for the TBI waiver is caregiver training. So if the caregiver wanted to attend a conference, then we could work with them on how they could get reimbursed for that training. We can't pay them directly, so we'll have to, I'm still working through that on how we're going to do that. So eligibility requirements. So for the aged and disabled waiver, of course, over the age of 65 or have a disability, you have to meet level of care. For the TBI waiver, they also have to have that TBI diagnosis. It doesn't include degenerative type TBIs. It's more of if it was an injury. The technical definition says an insult to the brain. Okay, the inter-I. This is our nursing facility level of care for adults. When they turn 18, we assess them with this criteria. The inter-I is a internationally validated tool that's used by multiple states. And we worked with a consultant called Myers and Stoffers to help ensure that it validated against our regulations for level of care, and ultimately it made more people eligible than not when they did this activity. So they'll do a pretty long interview and observation with the individual applying, maybe watch how they're moving around the home, ask them questions about their disability and their limitations. We talk about strengths in person-centered planning, but here they focus more on the limitations to get eligibility. And risk factors could include they need to be cued for medication, or they're a wander risk, or things like that. And of course, cognition is, how well are they remembering to do things. We have another inter-I tool for children age 4 and above. And I'm just going to go on to the next slide. So applying for the waiver. So Jacob talked a little bit about iServe. We do have our developmental disability application on iServe, but we're still working on developing the application for the aged and disabled waiver on there. However, when someone applies for Medicaid, they can mark right on there that I'm interested in the aged and disabled waiver and put some additional comments. So you can apply through iServe, but if they're already on Medicaid, we have another way to do it. There is a link within the Division of Developmental Disabilities website. If you go to the aged and disabled waiver button, it goes through a section that talks about eligibility, and then it defines the services in more detail. There's a hyperlink to the button that says eligibility, and there's a paper application behind that. So we will accept the applications through fax, mail, and in the event someone can't fill out the application themselves, we do take that into consideration, and when the assessor goes out, they can have it signed right there during the assessment. So we've made those accommodations as well. Anyone can help anyone fill out the application. We try to be careful on who we release information to, because sometimes there's providers out there that are being entrepreneurs and trying to get people to apply, and then I'm like, well, we can't release information about them back to you, but thank you for helping them apply. So we have to be careful about that with releases of information. So as I mentioned, anyone can help them apply, but when it comes time to do the assessment, we do that with the legal representative or the participant themselves. And they have to participate in the assessment and the person-centered planning process. When an application is received, our eligibility and enrollment unit screens the application to make sure they're eligible for Medicaid, looks for that disability determination or their age criteria, and potentially that TBI diagnosis. After that, we are doing a pilot in the Lincoln and Omaha area where we have a scheduler, so the scheduler might reach out and set up that assessment time with an assessor to come out to do that in-person interview and the level of care assessment. If the level of care is met, we send it on to the service coordination to do the next steps. If it's not met, they send a notice saying, I'm sorry, you're not eligible. The number one question I get is, how long does this take? Well, when you submit an application to the eligibility and enrollment unit, it takes a couple weeks for them to get something scheduled. So after that level of care assessment is done, the service coordination office should reach out within a week to find a time that works to meet. If someone does receive a notice of decision, of course, you always have appeal rights. If you're like, hey, you didn't take this into consideration with my level of care, so we do have appeal opportunities. Participants can appeal any notice that they receive. So service coordination for the developmental disability waivers is housed within the Division of Developmental Disability. For the aged and disabled waiver, we have partnerships and agreement with different entities across the state. So we partner closely with our early development network because they're more specialized in child development for the children birth to age 3. They serve over 25,000 children statewide, and only about 200 of them are on the waiver, to give you perspective. And then we have service coordinators that do work in the Division of Developmental Disabilities that serve children. So if they don't want to work with the early development network, we'll take them as well, but typically we work 3 to 17, and I supervise those teams. We have agreements with the League of Human Dignity. They have 6 offices statewide, and there are 8 area agencies on aging that we have agreements with as well for 18 and over. The participant does have choice of who they want to work with. If they don't like their service coordination office, we try to work with them and say, what don't you like about it, and work with them, but they do have the opportunity to transfer to the other side if they want. And the traumatic brain injury waiver is 18 and above, so those work with the league and the area agency on aging. Once a service coordinator is assigned, like I said, within a week, they'll contact the participant to schedule a meeting, and they will that's when they start doing more of a social assessment, like, okay, well, what supports do you already have in the home, and work on developing that person-centered plan. If the participant's school-aged, we can incorporate that into their IEP or the plan that they have through special education. And for the DD waivers, habilitation complements what they're learning at school. The service coordinator is supposed to take into consideration what the participant wants. Of course, we do have program limitations, but their preferences and their wants are important. And they're also responsible for overseeing and monitoring the waiver services. So Nebraska is using a national template called Charting the Life Course, which has 8 different life domains And it helps us through this interview process to help develop that person-centered plan and what they need. Of course, we want them to live as independently as possible and have quality of life when they're in their community. The person-centered plan figures out what's important to them and what are the actual needs. And that Charting the Life course helps them plan for the good life and maybe even think beyond today. You know, what do you want 3 years from now, 5 years from now? I will say that the person-centered plan may encompass more than what the waiver can offer, and our service coordinators will help them connect with those other community resources or help them brainstorm for ideas. Within this person-centered plan, there is a meeting, and they can involve their family. If they know who they want their provider to be, the provider can be at the meeting, and anyone else they want to participate. And this is written at a minimum of an annual basis, but if there's significant changes or if other things come up, of course we can adjust the plan as we go. We only authorize waiver services for a year at a time. And unlike Medicaid, we can't go backwards. We have to wait till this person-centered plan is in place and signed before we can move forward. And part of that is because of our agreement with CMS. We're tasked with ensuring the health and welfare of the individual in the community in lieu of an institutional setting. And if we don't have a plan in place and monitoring, then we can't ensure that they were safe prior to that plan. I mentioned earlier that the Division of Developmental Disabilities is working on eliminating our developmental disability wait list, and our goal is October of next year to have that changed. We do have a whole website about that and the milestones that have been completed, and Director Green is finishing up a tour of town halls. The one tonight is virtual. If anyone wants to attend, it's at 6 p.m. And you can find the information on the website. I have business cards with me if anybody wants my information. And there's questions.
Yes. All right. First question is, as a nursing home social worker, is there anything I can do to speed up an aged and disabled waiver application? It can take months to get a waiver application fully completed. This is much longer than it ever was before the change in structure, and this often means the client is having to stay at the nursing home for months on end rather than going home. As an aside, I do really appreciate how many hours are being approved per week for the higher acuity clients. This is a great change.
Thank you. I'm going to start with the compliment. Historically, like years ago, there was an idea that there was a cap and you couldn't exceed a certain cost threshold for approving services in the home. And since we've been in the Division of Developmental Disabilities, we've been shifting that mindset and saying authorize the services that are needed to help this person in their home. We look at the cost on an aggregate level, and there's some folks out there who don't need very many services, and there's other folks out there who need 24-hour care. So we are working to authorize the care that they need. And it's not perfect yet, but we have made some mind shift. So the other comment they made was basically calling out that it does take a little bit longer than it has in the past. So before eligibility and enrollment unit was in place, we did have our area agencies on aging and League of Human Dignity doing that level of care with adults. So they would come out and do the level of care and that person-centered plan all in the same meeting. Well, lo and behold, that's a conflict of interest, and we could be scrutinized from auditors that, oh, they're just approving them so that they can get financial gains, which I will say I don't think that's true. They're all nonprofits. There's no financial gains. There's just the cost of doing business. So the question was, how can I speed up the process? So as you're helping them fill out the application, if you know they're going to move to an assisted living facility, note that on there, because I do think that they look at that and they're like, oh, well, we want to make sure that it's a paid stay and that we're not impacting the providers. I'm service coordination, not the E&E unit, so I'm trying to, what would Bree say? It's kind of where my brain's at right now. They're doing what they can to respond to the applications as quickly as possible. Sending them in to the email address seems to be the easiest way and the most effective way to get them to them. There's one mailbox that they're managing statewide, but they're working on technology tricks within the mailbox to identify parts of states and things like that. 3 more questions? Okay.
Yeah, try to make it quick. And then also, to clarify, an application for waiver can be sent to E&E without a signature, and the evaluator can obtain the signature.
So I would put a note on the application saying individual was unable to sign, needs help. And so my partner Brianne and I have talked through that, and she is willing to have the assessor obtain the signature when she goes out there.
Okay.
But it has to be clearly communicated so it doesn't just look like an incomplete application.
For the Developmental Disability Day waiver, is the focus in community-supported employment, or is the entry sheltered workshops?
I don't like the phrase sheltered workshops. We want everyone to have the opportunity for gainful employment. That's part of our Olmsted plan. If you want to work, you can. Day services do have the ability to provide meaningful opportunities for someone to spend their day. And then when they're ready for employment, we can approach that goal at that time.
Okay, and then this last one, individual wrote in, so an application could be sent in for a person by an agency without having the person that is applying sign it. This is not how it is currently being done and causes a delay in getting the process started. The application is sent to the person to sign.
I'll take that feedback. I'll share that feedback with Brianne. So thank you for that feedback.
Right, very good. Karen, thank you so much. We appreciate it.